Welcome back, everyone. Brandon Fischer back with us today, Allen County's Health Commissioner. I was just joking how busy you guys have been in the last few years. So we hear so much about the national news likes to use the word triple-demic. We've got COVID, we've got flu, we've got RSV. Give us a sense how we're doing with each, especially locally.
So locally and looking across the state of Ohio, RSV is probably our bright point where we're starting to see RSV cases come down a little bit.
Okay.
But since Thanksgiving, we've really seen an increase in COVID cases and flu cases that require hospitalization. So right around the Thanksgiving time when everyone was gathering together, we just saw that it was a steady increase in cases of people going to the hospital for COVID and flu, and it just kind of spiked up in that week and 2 weeks after.
Is RSV, is it, I don't want to say strictly, but is it mostly with children? Is that, do adults get RSV or?
Adults can get RSV, but it's a disease that really impacts children, younger children especially, just with a respiratory virus. There's no vaccine for it. There's no major treatment that you can get. It's just more supportive care. And in younger individuals, especially if they haven't been exposed to that virus, it takes a toll on them until their body can develop the antibodies to fight it.
Yeah, and something I didn't know, we had a national story, I think a week or two ago. There were patients, children who were in the hospital, and I think one of them had RSV and COVID. I didn't know that you could get symptoms from each and that you could be that specific in a diagnosis where you could say, well, these symptoms are from COVID, these are from RSV. So now, if you're going to get vaccinated, I mean, it's probably more important than ever, right?
Right, especially you're seeing an increase in cases, increase of everything going on, and going into cold weather season, as we just discussed, a lot of people are going to be moving indoors. We got Christmas celebrations, end of year celebrations. These diseases like to spread in indoor environments when people are gathered close together. So if you are going to do that holiday gathering, you're not feeling well, skip the holiday gathering. Try sometime next week, next month, into 2023. But also get your flu vaccine, get the updated booster shot for COVID. That's going to offer you some of those protections. You may still get the virus, but you're not going to see as severe side effects that could lead to hospitalization or death from those. Yeah,
and you've talked about this before, especially if you aren't going to get it simply for your own health. You may be around somebody else who's older, has had health issues. You're doing it for them as well, right?
Right, and with our recent bump in hospitalizations from COVID, we're seeing that in individuals, especially over the age of 70, but even over the age of 60. There's a real big rise in those groups of individuals who are exposed to the virus and they just can't respond to the virus as well as someone that is in their 20s or 30s. So getting that vaccine can offer a way to protect those around you.
As far as COVID, I got my booster from the latest Omicron variant at you guys' clinic. It was simple. I was in 20 minutes, 25 minutes. Is that something people can still take advantage of?
Yes, until the end of the month. We still offer our clinic. It's out at the Clock Tower Plaza. We're open on Mondays and Fridays from 9 to 3. We do walk-ins. If you need a flu shot, we can offer it at the same time. So we get you in, get you to fill out the forms, and get you out and try to be as, offer little inconvenience as possible to your day. If you have questions, our nurses out there will talk through the different questions, talk through the different vaccines, and really offer you a ton of good information to help you through the whole thing.
Yeah, it's very simple. So as if we need anything else, we've had measles around Franklin County and Columbus. Are we keeping an eye on that? Is that spread any more outside of that area?
Not too far outside of that area, but it is a situation where if individuals are known exposures, the Ohio Department of Health informs local health departments who have that exposure. So we have been monitoring some children who've been exposed to measles, known exposure to measles, and get them treatment or get them vaccinated so that they don't catch that disease. Down in Franklin County, they had 77 cases so far. 29 of those cases required hospitalization in young children, and it's mostly due to dehydration, but it's a hospital stay that someone in age 1 to 5, you really don't want to go through that hospitalization. So getting that MMR vaccine early when you're able to get it at 1 year really offers that great protection. Measles is a very contagious disease and it hangs around in the air for 2 hours after someone has it in that room. So it's exceptionally important to get those shots when you need to, because it can lead to hospitalization and death, especially in young children.
Yeah, vaccinations are available. All right, thank you for the updates. We appreciate it. It's
Thank
good seeing you. Doug, more medical news coming up next on Minute Issue.